morning, everyone. I'm going to talk about the features of faculty and staff mental health policies, insights from top 10 global universities. I'm Sterling Plata from De La Salle University. Let me start with a check-in question. Based on this definition, how would you rate your mental health on a scale of 1 to 10? So the definition of mental health by the World Health Organization is that it is a state of well-being in which an individual realizes his or her own abilities, is able to cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. In this positive sense, mental health is the foundation for individual well-being and the effective functioning of a community. I became interested in mental health because many years ago, I had a burnout, and that affected my work, my motivation, and my contribution to my community as well. So in this study, it will be divided into several parts, and I'm going to talk about the background first. So according to Education Support 2021, the levels of stress and anxiety remain unsustainably high. Excessive workload and lack of work-life balance remain key drivers for poor mental health. And COVID-19 has had a significant impact on well-being. I'm sure you've also heard from your colleagues and you've experienced yourself about the excessive workload because of the new setup. They also found out a consistently high percentage of staff consider leaving the profession, and staff are considered concerned they will be perceived negatively if seeking support for mental health issues. The good news is that organizations have improved staff awareness of well-being policies as well as their implementation. So if there is one silver lining is that organizations are now recognizing the importance of well-being in their policies. Mental health matters, and the findings, according to Education Support, now these findings represent the experience of school and college support staff, teachers, lecturers, and leaders. This is their story. If we fail to act on these findings, we are complicit in the damage to the lives and opportunities of those responsible for teaching, guiding, and inspiring our nation's next generation. There's also this forecast that the next wave is a mental health crisis. And I have also observed in my students, a number of them had mental health problems during the because of this pandemic. What are the gaps in literature? So one gap is the lack of guidelines in crafting on mental health policies for staff and faculty. Most studies focus on the impact of the pandemic and not on policies. The DOLE 2008-2020 requires all private organizations to craft mental health policies and programs for employees and staff, but SHED has yet to publish the IRR for the implementation of the Mental Health Act. The present study, the objective is to analyze the mental health policy of top QS universities to uncover insights for university leaders as workplace mental health policymakers in the Philippines in preparation for the next normal. For the design, I use content analysis of mental health policies using a coding guide based on the policies in the DOLE 2008 referring to training, well-being, social policy, treatment, benefits, and support. The results and discussion. I found that the research found that there are three common features of university mental health policies. They are inclusive, they are accessible, and they are holistic. Let me give specific details. So, DOLE 2008 requires all private organizations to provide mental health training, education, and advocacy. And I found out the top 10 global universities make sure that the training, education, and advocacy are inclusive, meaning they are not only for faculty and staff, they're also providing training for dependents, for retirees, for employees with disabilities, and for those in the LGBTQ plus category. They're also accessible that they have an EAP, they have EAP providers or employee assistant providers. There are also internal programs and policies for training and education and advocacy. And they are holistic. No, the training and education include mental health literacy and wellness that includes training and resources on how to deal with personal and work challenges, including recommendations for legal, financial, and caregiving concerns. Let me give an example that MIT subscribes to KGA Inc. for the MIT My Life. My Life Services is a one-stop resource offered through KGA Inc., an external provider of EAP programs known for its leading work life and personal well-being services. My Life My Life Services provides MIT faculty, staff, postdocs, and families 24/7 access to a network of experts available to help with life concerns. Other examples, Imperial College London provides free mental health first aid certification program. It's a promising policy on training. It encourages its employees and teachers to be certified. The mental health first aiders are their first line of support, and Imperial College London has 1 to 100 ratio of mental health first aiders and targets 1 in 50. In the Philippines, because of the lack of psychologists and psychiatrists in universities and colleges, this is a promising policy. In addition, the training programs are holistic, such as UCL 7-week mixed mental health arts program delivered by TAF. In terms of well-being policies, they are also inclusive, accessible, and holistic. So well-being policies refer to those that are related to work-life balance and well-being in general. They're inclusive because they include faculty, staff dependents, retirees, employees with disabilities, and the LGBTQ, and they are also holistic. Let me give you an example that Harvard University has a separate unit called Harvard's Office of Work Life, and it supports health, well-being, work-life integration of benefits, eligible faculty, staff, and postdoctoral fellows, as well as their spouses, partners, and dependents. Some programs include best practices in work-life management, work-life consultation, domestic violence, addiction, legal and financial concerns, stress management and mindfulness, supports for the child and elderly care as well. In terms of social policies, so social policies refer to non-discrimination, confidentiality, disclosure, and work accommodation. And the study found that it includes employees and those with disabilities, employees with mental health conditions. The policies are accessible because they are all online, and even outsiders like me, are able to access the policies. They're also holistic because there are policies for diversity and inclusion for all, work accommodation for those with bereavement issues. So social policies include non-discrimination, confidentiality, disclosure, and work accommodation. Employees and faculty members should be assured that when they disclose that they have a mental health condition, that this disclosure will not affect their employment and permanency. An example is the University of Oxford that has Equality and Diversity Unit, which implements policy to support for those with disabilities. For example, it has a statement on reasonable adjustments for mental health, where it provides examples and ideas for policies on what to support that are reasonable, proportionate, and effective. It also guides managers when they have a staff member who discloses a mental health problem. In terms of treatment, benefits, and support, support refers uh, to ongoing consultation, ongoing what do you call this? Counselors. Okay, counselors benefit in terms of compensation for the diagnostic, treatment, and rehabilitation. All the 10 universities provide treatment for faculty, staff, and dependents. The treatments are provided internally and through EAP providers, and holistic because they also include substance abuse, smoking, sleep problems, and bereavement. In terms of benefits, they include faculty and staff through EAP providers and include treatment and rehab for mental health, substance abuse, smoking, and sleep problems. Support and counseling are inclusive for faculty, dependents, retirees, employees, LGBTQ. They are available, counselors are available online. The policies are online. They also provide support for upstream, meaning prevention, and downstream, meaning for those with mental health conditions. So for the conclusions and recommendations, the policy should be inclusive, accessible, and holistic for training, well-being, programs, social policy, treatment, support, and benefits. The study also recommends inclusion of mental health and well-being in HMO services and offerings. Third-party employee assistance programs can be university partners, and treatment support are part of the faculty and staff benefits. Let me close with this message that mental health promotion used to be a nice to have in schools and workplace. But the COVID-19 pandemic has shed light on the importance of well-being. Consequently, DOLE 2008-2020 is an urgent and pressing call to action that all private organizations, especially universities, must enact seriously because mental health cannot wait. So thank you so much for your interest in this study.